Good evening. Welcome to this Chess Council of India Thursday webinar. Greetings from Chess Council of India. I am Dr S Jayaraman. I'll share my screen. Every Thursday we are doing a different kind of webinar. This time is different. There is a sleep webinar series part 1 we are going to take now with the stalwarts in the sleep medicine, and I'll be sharing my screen now. Good evening, welcome to all. So this is the Chess Council of India Thursday webinar. It's sleep webinar series part 1. Today we are going to concentrate more about the sleep physiology. I am Dr. S Jayaraman. I am the moderator of this today's webinar and the panel discussion. I am the senior consultant working in the MGM Healthcare, Bilroth Hospital, Apollo First Med Hospital in Chennai. I have my own Sri Jayam Chest and Sleep Clinic in Chennai. I have interest in interventions like basic bronchoscopy and thoracoscopy and sleep disorder breathing. I am the chairperson of MGM Academics, secretary of IMA AMS, Academy of Medical Specialties of Tamil Nadu State Branch, and the immediate past president of IMA Chennai Villivakam and Ayanapuram Branch. So this is the today's program. First of all, I thank you very much, CCI Chairman, Founder, Trustees, Dr. N.H. Krishan sir, and Narayana Pradeepa sir, and the CCI National President, Dr. Ashish Dubey sir, and CCI National General Secretary, Dr. Anil Maske sir, and CCI Webinar Coordinator, Dr. Vijaykumar Chennam Chetty, and today's the program architect and directors, course coordinators, Dr. Shivani Swami, Jaipur, and Dr. Ravi Dosi, Indore, Madhya Pradesh, and and all the delegates and the my panelists. So welcome to this CCI Sleep Webinar Series Part 1. It's a sleep physiology. We're going to discuss, take the thing. In the discussion point, so these are all the highlighting points in this webinar. One is the sleep as a vital part of our daily routine. Sleep in physiological states like pregnancy, elderly, teenagers, sleep and metabolic system related changes, circadian system, sleep homeostasis, teleology of sleep centers. These are the headings we are going to discuss in detail. May I introduce the first speaker, Dr. Dibakar Sahu. He is a MD Pulmonary Medicine, working in All India Institute of Medical Sciences, Raipur, as Associate Professor in the Department of Pulmonary Medicine, Sleep and Critical Care Medicine, Raipur, Chhattisgarh. He has academic qualification, MD Pulmonary Medicine, and teaching experience of more than 14 years post-MD. And he has 18 national and international publications and 2 international conference presentations. He has various membership from European Respiratory Society, American Academy of Sleep Medicine, ATS, World Association of Bronchology and Interventional Pulmonology, Indian Association of Bronchology, Indian Chest Society, NCCP, ICAI. Areas of interest mainly the sleep disorders, critical care, and lung cancer. Welcome, Dr. Dibakar Sahu, for this webinar and panel discussion. May I welcome the second speaker, Dr. Aditya Aggarwal. So he is MD Respiratory Medicine from Institute of Respiratory Diseases from SMS Medical College, Jaipur, and currently is a consultant pulmonary sleep and critical care medicine, SN Super Specialty Hospital, Sri Ganganagar, Rajasthan. He has several publications in the national and international journals. The Joint Secretary of Thoracic Endoscopy Conference recently held at Jaipur, and he has invited faculty of various national conferences. He is a lifetime member of NCCP and Thoracic Endoscopy Society, IAB, and Chess Council of India. Welcome, Dr. Aditya Aggarwal. And we have Dr. Ajay Godse, MD, Pulmonary and Sleep Medicine Physicians, and he is a fellow of American Academy of Sleep Medicine and World Sleep Society. Exam pass candidate. He is a very well-known sleep guy. He has a diploma pediatric in sleep medicine from Colorado and ASM Education Committee member from 2021 to 2022. Currently, he is a consultant and head Department of Pulmonology and Sleep Medicine. So, Bhakti Vedanta Hospital and Research Institute, Mira Road, Mumbai. Director, Sun Chest and Sleep Medicine Clinic, Kandivali East, Mumbai. So, he has 6 publications in national and international peer-reviewed journals and principal investigator for phase 3 international clinical trials of asthma, COPD, viral pneumonia, OSA, and inhaler devices. Welcome, Dr. Ajay Godse. Last but not the least, Dr. Kewal Krishan, Senior Consultant from Kota, Rajasthan. He has finished MD from Udaipur, and he's the director of Navya Swasa Asthma Care Center in Kota, Rajasthan. He has several fellowship, Indian Chest Society, CCI, ERS, Indian Medical Association, IASM, and CIASM, Southeast Asian Academy of Sleep Medicine. He participated in various conferences as a faculty at national and state level, and many awards from the regional and the national level. Welcome, Dr. Kewal Krishan, for this wonderful panel discussion. Thank you very much. So, with that, we'll move on to the presentation. The flow of event will be there are two talks. The first talk by Dr. Dibakar, followed by Dr. Aditya Aggarwal. May I invite Dr. Dibakar to speak on the subject on the sleep physiology, that is sleep basics and stages. Over to Dr. Dibakar Sahu.
Good evening, everyone, and thank you, Dr. Jayaraman. At this outset, I want to thank all the CCI team, especially Krishna sir, Dr. Dubey, and all the core committee of the CCI, as well as the this course coordinators, Dr. Shivani Swami and Dr. Ravi Dosi, for giving me the opportunity of this talking in this webinar. Today I am going to briefly talk about the normal sleep physiology. The normal sleep physiology is important to know before we can go about the different sleep disorders. So, what is sleep? Sleep is a reversible state of behavioral state of perceptual disengagement from an unresponsive to the environment. So sleep is a physiological state, and sleep is always a reversible from the wakefulness, and it is a arousable with appropriate stimuli. When we goes to sleep from the waking, there are few characteristics you should know. That is, it is a very rapidly reversible state, and that means you can reverse the state of sleep by the mechanism of some sensory stimuli, and it is a temporary state of physiological activity, and it is also a cyclic event. That means the person goes to sleep every day at a certain period of time, and during the sleep you can see during the sleep there is a reduction in the motor activity, and the metabolism also reduced. So what are the behavioral definition of sleep? When we goes to sleep, there is closing of the eyes happens first, and in that event the person is awake but the eyes were closed, and then during that stage the person should be in a very supine or reclined position. There is decreased responsiveness to the external stimuli, like like other sensory and motor stimuli, and the during the sleep the movements are reduced or very limited, and then this stage of sleep is again reversible to appropriate sensory stimuli. That means you have these are the differentiating points to a person who goes to coma, and goes to coma. Then what are the sleep cycle phases? There are different sleep cycle. You can see the hypnogram here. With that hypnogram we can know the different sleep cycles. So when a person This is a hypnogram. When a person goes to sleep in at around 10 o'clock, 10 o'clock he goes to sleep in the brief wake period. Then the person directly enters the non-REM sleep, and then with a brief N1 sleep, then there is N2, and this non-REM sleep changes to REM sleep. So during the whole night, one person goes to there are they go they completes around 3 to 5 sleep cycles, like non-REM to REM, and then again non-REM to REM. So like this happens. So each sleep cycle constitutes around 90 minutes. So after about 80 minutes of first sleep cycle, the person goes to the REM phase of the sleep. So after this 90 minutes of one sleep cycle, the person enters to another sleep cycle of same non-REM, then REM. So you can see here in the in the entire duration of this sleep cycle in the whole night, you can see these are the REM part of the sleep hypnogram. There you can see in the initial part the REM is less than the non-REM. But when the person goes to the sleep in the later half of the cycle or later half of the night, and here you can see the REM part increases. So when the person goes to the sleep, it enters the non-REM part of the sleep cycle, and when he wakes up from the REM part. So, the sleep architecture in a normal healthy adult is 3 to 5 cycle of sleep happens during the night, and stage N3 is the most stage in the or prominent stage in the first half of the night, and with each cycle the non-REM each cycle of non-REM sleep, the N3 decreases. That means the delta power decreases with each cycle, and with each cycle the REM part increases. So REM density, that is the number of eye movement per time during REM sleep, is higher in the later episode of the REM sleep. So coming to the different cycles, this sleep cycle is divided into non-REM and REM, and non-REM cycle is again divided into 3 parts, like stage non-REM 1, 2, and 3. And coming to the duration and the characteristics, the stage 1 or N1 is the shortest of 5 to 10%, and here the light sleep happens, and there the person goes to the transition to the deeper sleep. In stage 2 or N2 is the maximum duration during the whole sleep cycle, and there is a decreased heart rate, and during this phase there is body temperature also comes down, and in this you can see the sleep spindles. And the deepest part of the deepest sleep is the N3 sleep, which is around 15 to 20% of the whole sleep time, and there is restorative functions of the body happens, and in REM sleep is around 20 to 25% of the cycle. During this cycle, there is dreaming, vivid activities, and there is increased body brain activity happens. So different characteristics as per the different stages. The EEG activity or beta rhythm in the awake stage, and it slowly goes to the lower waves, or the waves are low frequency waves happens during the as the stage goes on. Then then when the each activity in a non-REM sleep is usually synchronous, but in REM sleep you have desynchronized low amplitude mixed frequency waves are seen, and the EMG is always high in the awake stage. Then there is low EMG activity is there in the as the stage goes on. And in the REM sleep, there is atonia occurs, or there is small twitches happens in, and there is a burst of REM activity in the eye happens in the REM sleep. So, what are the differentiating between REM and non-REM sleep? In a REM sleep, you will have a vivid dreams, brain activity increases, muscles are relaxed in that phase, and it plays a vital role in emotional regulation as well as memory functions of the human body. Whereas non-REM sleep has three stages, as we have discussed, that progress from light to deep sleep, and it is essential for physical restoration as well as growth and immune function. So, what are the importance of sleep? Every human being needs some amount of sleep for their physical and mental health, and it supports the cognitive function. The emotional regulation happens, the immune response increases, and the overall well-being of the human body happens uh, during the sleep. So, what happens when we have a good amount of sleep? The cognitive function increases. It impacts on learning. Good amount of sleep enhances the focus, creativity, as well as the problem solving abilities. A Whereas a sleep deprived brain shows reduced cognitive function. The sleep and memory consolidation also happens during a good sleep. So the sleep consolidates our memories, and during sleep, the brain processes and organizes information which we have observed during the whole day. So, understanding the complex physiology of sleep can greatly enhance the personal health. Adequate sleep is essential for overall health and well-being. It affects the mental clarity as well as all the emotional stability happens. Physical health improves, and if we have insufficient sleep, that can lead to various health issues, including cognitive decline. There will be different obesity happens, and cardiovascular problem ensues during the sleep deprivation. As also understanding the significance of sleep can help individuals to prioritize their rest for better health outcomes. Thank you so much.
Good evening to all esteemed members. After an interesting discussion by Dr. Dibakar on sleep basic and sleep stages, we'll progress further with our next topic, sleep in physiological states. So let me introduce myself first. So I am basically Dr. Aditya Aggarwal, working as a consultant pulmonary sleep and critical care medicine in SN Super Speciality Hospital in Sri Ganganagar. And let's start with the topic. So as sir has already discussed, we'll brief it out in a nutshell and then we'll move it further. So what is sleep basically? Sleep is a naturally recurring state of mind which is characterized by altered consciousness. The muscle activity gets reduced, sensory activity get inhibited, and there is very less interaction with environment and external stimuli. So we can see the different sleep postures in various animals. Every animal has its own sleep postures. These are the sleep postures of humans. They have a different various sleep postures. Now coming on to the cycle of the sleep, already discussed, there are two phases, NREM, non-rapid eye movement, REM sleep, rapid eye movement. NREM always precedes REM. We can clearly see over here. One epoch of the sleep is usually about 90 minutes from the wake to the REM sleep, or as already discussed, character, and then there are various cycles of sleep. There are various stages of the sleep like N1, N2, N3. Typically, hypnic jugs are in N1. Already discussed. N2 characterized by sleep spindles and K complex. N3, which is basically called as a deep sleep. The memory gets consolidated over here. It is also called as a rejuvenating phase. Parasomnias do over here, and in the coming on to the REM sleep, there is a loss of temperature, paralysis. Person do have dreams in such a sleep. Usually the length of cycle in humans is of 90 minutes, and there are 4 to 5 cycles. The cycle of various animals do differ according to the brain weight. For example, in the cats and dogs, there are cycle is of 25 minutes. Now again, we have already discussed about it. There are various stages of the sleep. Stage 1 NREM sleep is a mixture of alpha and theta waves. Stage 2 sleeps characterized of sleep signals and K complex. Stage 3 NREM sleep, mixture of theta and delta waves. Similarly, progressing up to the REM sleep, which have fast acting waves. Usually REM sleep has of 5 to 15 minutes, and mostly in an adult sleep, it is predominant of NREM sleep, which is usually around of 50 to 70 minutes. And there are similar 4 to 5 cycles of sleep per cycle in a human. Now EEG recording already seen. There are various kind of waves clearly mentioned over here. We have discussed. We won't waste our much time over it. Distribution of sleep. As the night progresses, the duration of REM sleep increases and the duration of NREM sleep decreases. Clearly seen from the image. Now coming on to the various sleep physiological changes. If we see with the changes of the sleep with age, we can clearly see newborn sleep more. We know about it. That newborn sleep usually up to 18 hours, and as the time progresses, the sleep duration decreases. In an adult, typical adult sleep around 7 to 8 hours. There could be plus minus of 2 hours. A pregnant woman, you also usually sleep up to 8 hours. And as the age progresses, the duration of sleep do decreases. So basically, we can see in the slide the sleep changes over the lifespan. We can see in the during the time of gestation, there's continuous REM sleep, and as the baby get birth, with the time the NREM sleep duration increases and the REM sleep duration decreases. Till the birth, the REM sleep constitute about 50% of our sleep, and as we go into the adulthood, the REM sleep duration decreases by 20 to 25%, and the NREM sleep do increases with the time. As we can see here, the sleep architecture over the lifespan, children do have predominance of REM sleep, and the NREM sleep duration is less comparison to the adults, and in the elderly, there's a lot of sleep fragmentation, and the REM sleep duration doing decreases. We can see in a single day, the newborn do have a lot of fluctuation. They do have a lot of circadian fluctuations in their circadian rhythm over the sleep. Usually they have 3 to 4 hours of sleep, and then they usually do get awake, while the circadian rhythm becomes constant as we become an adult, and while there are a lot of fluctuations in newborn infant and in the older age group, as we can clearly see from this table. Now coming on to the sex differences in the sleep. Usually we have a mixed evidence in this class, as some studies show, as we can see, this is a study which is done by Suzanne Redline, and they did a study and they see the effects of age, sex and ethnicity in sleep disorder and on the sleep architecture, and they found out that there is a larger differences in N3 percentage in men as comparison into the aging women. While there is another study which is done by Fredericia Lata, and this study shows no sex difference in N3 percentage, while there's a difference in delta activity in older women and with the larger difference in REM sleep. And if we see in the older men, they do show the delta activity but during the NREM sleep and lower levels of alpha activity. This difference of alpha delta activity in women might also be the basis of various parasomnias and insomnias in a woman, which could become the basis of it. Now, if we see a very good recent data, a systemic meta-analysis, which is published in the Lancet by Mark Bullough and their team, and they do study the normal parameters in healthy adults, and they found out that there is no sex difference between the men and women with respect to total sleep time, sleep efficiency, wake after sleep onset, and time in different sleep stages. We can clearly see with this table in the men and women it is not much of a difference, while they do quote it out that men had lower REM latency and mean oxygen desaturation comparison to the women, and they do have high apnea hypopnea index and arousal index than women. Coming on to this table, this is taken from Krieger, and it typically denotes, and it is a recent table which denotes there is a significant difference in the sleep disorders, while insomnias are practically more in women, as we can see in this table. With the time, at the time of adulthood, at the time of puberty, the difference in insomnias do typically increase, as we can see from this table, and while it becomes a constant as the age progresses. So it is the constant prevalence of insomnia which is higher in women compared to men throughout the adulthood and further on, as we can see from this study which is done. And we can see another things, sleep onset latency is shorter in women, sleep efficiency is higher in women, stage N1 sleep is comparatively lower in women, stage N3 sleep is comparatively higher in women, and slow wave activity that we can see there is a greater response to sleep deprivation in women than men. Now, if we come to another other sleep disorders, the OSA, which is less common in women. So this is a very healthier saying that, oh yeah, if a person snore, then it might also leads to differences in the physical relationship, more prone to depression, tiredness, impotency, bad mood, and leading to further frustrations. Now, further narcolepsy, if we can see clearly, the narcolepsy is more common in men. The REM sleep behavior is also more common in men as comparison to a healthy woman, while the restlessness leg syndromes are more common in women as compared to men. Now, coming on to the sleep in pregnancy. If we can see this table clearly, we can differentiate. While during the first trimester, there are a lot of hormonal imbalance, there are a lot of physiological changes occurring in a female. So for that, we can clearly see the total 24-hour sleep time is increased in a female in a first trimester. The sleep efficiency do get decreased, and the slow wave sleep do get decreased, and also the wake after sleep onset do increases with number of naps. With the time, as the pregnancy progresses, they do get stabilized, but at the end of second trimester, again, the lot more hormonal fluctuations at the time of delivery, also the lot more hormonal fluctuations occur, then the sleep efficiency do decreases, the duration of NREM and REM sleep during decreases during the late pregnancy, and further, females are more prone to sleep apneas. There are nocturnal features which do occur in pregnancy, like urinary frequency do changes, snoring do increases, the female do experience heartburns, vivid dreams, and there are various other leg cramps, shortness of breath, snoring, anxiety. These all increases as the pregnancy progresses. Then there are daytime symptoms which do get prominent during the later phase of pregnancy and the early pregnancy period. So sleep disruptions are very common in pregnancy. Central sleep apnea is comparatively uncommon. Then obstructive sleep apnea in pregnancy is a state of increased risk of obstructive sleep apnea. The Mallampati score do increase during the pregnancy. There is significant reduction in upper airways due to the pressure of the abdomen on the lungs, so resulting in reduced in functional residual capacity, which leads to increased airway collapsibility. Then the effects of progesterone do have an impact. It creates more negative inspiratory pressure, resulting in a vacuum effect on upper airway, resulting in reduced FRC and increasing propensity of sleep apnea. But there are some protective effects as well. The increase in minute ventilation, the decrease in rapid eye movement sleep, and the preference for the lateral position do have a protective effect, and they do have a propensity of decreased sleep disorder breathing. More and more, if we see, it is approximately in 35% of the pregnant women, they do snore, and they do have an increased risk of sleep apneas and further sleep disorders. Now, there are some beautiful studies published in European Journal in 2010 by G. Borley and Raker CA, which have shown significant association of sleep disorder breathing with in females, pregnant females with gestational diabetes and hypertension. There is a case control study which shows odd ratio of 5.6 for such women which have hypertension if comparison to the non-hypertensive females. Similarly, they do compare age, body mass index, and they do further find out, they do correlate, and they do find out that there is a significant association of sleep disorder breathing with pregnant females who do develop gestational diabetes. If we see further evidences is done in the 2007 by POESD group, which found that uh, treatment with CPAP with a patient with sleep disorder breathing but no sleep apnea, and treatment with a patient with CPAP with sleep disorder breathing. So the patients who have snoring and who do have symptoms but they don't have a sleep disorder breathing have better control in their blood pressure comparison to the treatment which don't get treated. And the CPAP treatment also showed to have improved blood pressure in various stages in sleep women in who develop severe preeclampsia comparison to the females who don't get a treatment. So this proves that CPAP do have a beneficial role in females who do have snoring and such symptoms but don't have sleep disorder breathing. Now coming on to the topic sleep in intersex and transgender individuals. Though it is very least study and there is a very little research available, we'll try to see through it. There's a study which is done in the United States in 2014. They do study the prevalence of healthy sleep duration in such individuals, and they found out that one-third adults in such patients do have sleeping disorders and they do sleep less than 7 hours a night. And then there is another study, a cross-sectional multicentric study done by Matthias Orr group in 2017. They use a Pittsburgh Sleep Quality Index score and they studied sleeping problems in transgender individuals, and they do found out that 80% of such individuals report poor sleep quality. However, the such studies are very limited and they do lack quality evidence in such studies. So my takeaway with such sleep physiology is that the sleep disturbances are common in extremes of age. In elder adults, usually the sleep disturbance etiology is multifactorial. They do have some medical symptoms, they do have some psychiatric conditions, and they do have some behavioral issues which might contribute to these symptoms and to these disorders. And while during the pregnancy, there are various physical and hormonal changes which do cause sleep disturbances and predispose women to a sleep disorder. Thank you.
Yes, we had a wonderful talk by Dr. Dibakar Sahu on sleep basics and stages. So we'll explain so what is the basic things about the sleep and the stages, etc. And we have a wonderful talk by Dr. Aditya Aggarwal, sleep in physiological stages, mainly the men and women differentiation and pregnancy, how it affects the sleep quality, etc. So wonderful discussion, lot of points. I request the audience, please post your questions in the chat box and we'll answer appropriately. So with that, we'll move on to the panel discussion. So I pose the first question to Dr. Kewal, sir.
Yes,
so what is sleep by definition, and why do we sleep? What is the reason behind the sleep? Yeah, brief about
Good evening, everyone. Good evening, everyone. Definition of sleep has been already discussed by the previous two speakers, but I will repeat it again. Sleep is the temporary state of unconsciousness, unlike coma or general anesthesia, in which brain is primarily responsive to internal rather than external stimuli. And it is a natural, complex, dynamic process. It's not a passive process. In this sleep, brain is also active and most of the organs are also active. It's a natural, complex, dynamic process and cyclic and self-regulated, which is easily reversible to wakefulness. And it's an essential aspect of every human being, or you can say for every live organism. And why do we sleep? Still, we don't know, but there are hypotheses. And these are, it helps to restore the physical health, such as regeneration of tissue, muscle repair, and it builds bone. It helps our brain process and consolidate the memories. It transfers the information from hippocampus to the neocortex for the long-term storage and clear out toxins that can harm brain cells. And it helps to regulate insulin, growth hormone, hormone for appetite. It helps in cognition, manages the stress, anxiety, and emotion, which are essential for the mental health. It also restores the cardiovascular health. So overall, sleep is an essential physiological behavior for healthy life. That's why we sleep.
Thank you, Dr. Kewal, sir, for this wonderful answer for this sleep. So you all know very well, sleep is an extremely complicated process. So it's an active state of unconsciousness. So by definition, already you mentioned about that, sleep is a state of unconsciousness from which is a subject can be aroused by appropriate sensory or the other stimuli. So the why do you sleep? So exactly the sleep to rest mainly and to heal and to learn, and a lot of theory behind the thing. Respiratory theory, preservation theory, and production theory, and a lot of memory consolidation, repair, and balancing activities, and hormonal balancing activity. Everything is happening during sleep. So sleep is a vital metabolic function like respiration, excretion, reproduction. This is a very important vital metabolic function. Thank you, Kewal sir, for this wonderful explanation for the basics of sleep and other why do you sleep, reason for sleep and all. Thank you. So we'll move on to the Dr. Dibakar. So what do you mean by a good quality sleep, or by definition, good sleep? What is good sleep? What is bad sleep? Dr. Dibakar. Dibakar, you have to unmute yourself. Yeah. Unmute yourself. Dibakar, unmute yourself. Unmute. Dibakar, check your mic. Unmute yourself. Mic. There is a There's left side near video, audio column, no? Just to click the audio button. No, I'm talking to Dibakar Sahu. Dibakar. Okay. So, meantime, I'll ask a question to Dr. Aditya Aggarwal. So, what is your take on... Pardon? Dibakar, just click the button. Unmute yourself. You're muted now. Fine. Yeah. Okay. Yeah. Dibakar, just see the screen, left side, audio, video. In the audio button, you can click that. Yeah. Now Dibakar is going to log out. Again, he will log in now. Okay. We'll take this question next. I'll ask Aditya. So what is your take on nap? So daytime sleep. So is it is it beneficial, and what is the science behind the nap or power nap, whatever you say? So Aditya.
Well, good evening everyone, to all respected esteemed faculties. So yeah, very well said, sir. A nap is basically a short period of sleep, usually which is taken typically during the daytime, just so that we may get a proper rest and recharge ourselves. It usually ranges from 10 to 30 minutes, though it might last a little bit longer, but usually it is between 10 to 30 minutes. And the basically nap helps us in elevate our tiredness, it improve our alertness, it basically boost our mood, and it increase our day-to-day productivity. So, but usually nap should be kept short. If it is kept longer, then it is refreshing only when it is kept brief.
Right. Yeah. That's why the name is a power nap. It's beneficial only. So if we don't, if we exceed more than 30 minutes, so it may cause nighttime sleep, it's prolongation, a lot of issues. So minimize sleep as 15 to 20 minutes. That is a very beneficial thing only as per the science behind the nap. Yes, thank you. Dibakar, are you ready? Dibakar? Okay. So I'll move on to Dr. Ajay Godse, sir. So tell us in brief. So what do non-rapid eye movement and rapid eye movement sleep signify in our daily routine? Ajay, sir.
Thank you, CCI, Dr. Jayaraman, for giving me the opportunity to be part of this wonderful sleep series. Okay, let's come to your question. NREM and REM sleep are two distinct but very complementary part of our sleep. So NREM is basically, let's talk about NREM first. NREM is basically about restorative functions. So physical restoration, energy conservation, memory consolidation, emotional regulation, all these things happen in a NREM sleep. So during NREM, especially in a stage 3, that's a delta wave sleep, your body repairs, your tissue repairs, your muscles builds, your strengthens the immune system. In a metabolic activity slows down in energy conservation, so you basically start getting a metabolic benefits. Memory consolidation, we always see that facts and knowledge part of the memory gets consolidated into N3 sleep, whereas REM sleep actually takes the other part of the memory consolidation. Emotional regulation is another important parameter which NREM sleep actually regulates. If I give my take on REM sleep, it's more of a cognitive and emotional processing. REM sleep is associated in high brain activity. It's a critical for processing and storing of procedural skilled memory. What I was talking about NREM sleep is basically fact and knowledge, and where it is skills and habits in a REM sleep. Emotional resilience, dreaming. Dreaming is something which is very important, which happens in a REM sleep. And dreams actually give us safe space for a brain to stimulate some experiences which are not really happened, but they are in the subconscious mind of our brain. Neural development also happens in a REM sleep, especially in the infants and young children. That's why as we saw in a physiology first talk, that REM sleep is very significant and bigger part of your sleep cycle in your early childhood. So neural development happen in a REM sleep. So basically we need both the stages of sleep. They should work complementary with each other and give us a healthy life.
Thank you. Thank you for this wonderful update on non-REM. Each stage is very important. There are some special characteristics of the memory consolidation. If you take the dream, mainly occurs in the REM stage. So in infancy, they have long sleep, long duration sleep, all important each every stage. With the non-REM, N1, N2, N3, and the REM stages. REM stage is a very paradoxical or a very active sleep. So these things are very, very important. So if you understand this kind of physiology, then coming to the pathological disorders, you will easily do the proper treatment for that. There are several phenotypes. Okay, we'll move on to the next one. So the Dibakar, are you ready? Dibakar, sir? Yeah, this is a question to you. So what do you mean by good sleep, good quality of sleep? Dibakar,
sleep quality or good quality sleep is essential or critical as the quantity of the sleep. And there are various elements which are described by the National Sleep Foundation. And foremost important is the sleep latency. That means with the time it takes to fall asleep from the wakeful state or after lying down. And that means falling asleep within 15 to 20 minutes is considered normal. So longer sleep latency may indicate stress and insomnia and the irregular sleep pattern. Then again, the awakenings during the sleep or the sleep fragmentation. The less number of awakenings or sleep fragmentation will lead us to good quality of sleep. If you are sleeping longer, but there is more awakenings, that means you are not a very good quality. And repeated awakenings reduce the time of sleep, and deep or NREM sleep in those also has a less quality of sleep. And Another important parameter is wake after sleep onset. And that means the total time spent after the onset of sleep, whether your onset is in the REM or non-REM. So, wake after sleep onset should be less than 20 minutes for a good quality of sleep. So, longer wake up periods reduce the total sleep time, and the restorative functions in the body gets compromised. Then another important parameter is the sleep efficiency. If sleep efficiency, as we all know, is the ratio between the total sleep time to the total time spent in the bed, or total bedtime. It is expressed as percentage, as you all know. So more than 85% of sleep efficiency is considered as a good. So there are key factors which helps us to find out the good quality sleep. That is also the duration. In an adult, it is considered that 7 to 9 hours of sleep is sufficient. But and also the person should align to the circadian rhythm. That means the cyclic and the circadian rhythm should be maintained, and the continuity, that sleep should be uninterrupted, and time spent in the N3 is also essential, because that N3 sleep gives us the restoration, physical restoration, as well as the cognitive processing. So prioritizing both the quality and the quantity, individual can maximize the restorative benefits of the sleep, and hence overall health and well-being. That is
Thank you,
my take
Dibakar.
on good quality.
Yeah. See, quality matters than quantity. Of course, quantity also important. The duration of sleep and average adult, we are spending, one third of life, in sleep. So average adult 60 years means 20 years we are sleeping, during our lifetime. So quality of sleep, in the sense, during a sleep time, uninterrupted, continuous, very long duration of sleep. You wake up in the morning, you feel fresh, active, energetic. This is the definition of the good sleep. If any interruption in between, a lot of physical and other nocturia, there are so many kinds. It may affect your sleep cycle, causes a lot of pathological problems. And the duration, already mentioned about 6 to 8 hours in adult sleep, is very important. So quality as well as quantity matters in a case of sleep health, to prevent unnecessary mobility and all. Thank you, Dibakar. And we'll move on to Dr. Kewal, sir. So tell us brief about the sleep centers. So what are the centers regulating the sleep in the brain, in the nervous system? Yeah.
The sleep center in the brain is a complex network of neurons which regulate our sleep-wake cycle via the circadian rhythm and the homeostasis. Main nucleus which participate in the sleep is suprachiasmatic nucleus, which is the part of hypothalamus. It activates by light through the retinohypothalamic pathway. And in returns, it inhibits the release of melatonin from the pineal gland, and simultaneously it activates the inferior medial pathway via the spinal cord. It activates the superior ganglion. It activates the adrenal gland, and that adrenal gland will release the epinephrine and the cortisol, which activates the internal organ of the body and stimulates the biological clock in the periphery. And on the other way, the center for the wakefulness are in the brainstem, pons, midbrain, which receives sensory information from the spinal cord and relay information to the thalamus via the ascending reticular activating system and stimulate the cortex, which play a vital role in regulating the arousal, attention, and the wakefulness. The second network is the VLPO, or you can say ventrolateral optic hypothalamus, which inhibits the tuberomammillary nucleus in hypothalamus, lateral hypothalamus, which causes inhibition of the orexin and maintain the NREM sleep. On the other hand, locus ceruleus in the brainstem and median raphe send monoaminergic information uh, and activate the tuberomammillary nucleus, lateral hypothalamus nucleus, which releases the orexin, which is responsible for the cortex stimulation, and it regulates the wakefulness and regulates the REM sleep pattern. It also known as it also you can say it acts as a flip-flop switch which maintains the regular sleep-wake transition and preventing the abrupt changes and maintaining the sleep quality. These are the basically sleep centers, which is very complex. ऐसा लगता है जैसे आपको समंदर के अंदर डाल दिया हो छोटे बच्चे को उसको समझने के लिए. So it's a complex neuron activity basically.
Thank you, Kewal sir. Actually, the sleep mechanisms, the science behind is the lot of complex neural mechanisms. So if you take the rapid eye movement sleep, there are tonic and the phasic phase, which involves the parasympathetic and sympathetic nervous system and a lot of centers. So pontine, hypothalamus, suprachiasmatic nucleus, all important to the sleep inhibition and sleep suppression. A lot of things. It's still a lot of research is going on to clear about all insight on the sleep mechanics, etc. So the Krishan sir put up message in our WhatsApp group. So far, 1,336 login in our webinar. So it's a nice thing only. So sleep is a very important subject, but in general, this is an recognized, underdiagnosed subject. If you ask any layman about the sleep, so very less important to know the sleep, and even our physicians also ask any primitive medicine checkup department and all history of sleep, any snoring, anything. So very less. So as sleep physicians, we have to create a lot of awareness. This is one of the very good platform. I thank you, Krishan sir, for this wonderful opportunity to spread the knowledge, sleep knowledge across the nation and neighborhood countries. Thank you. So thank you, Kewal sir. So we'll move on to Dr. Dibakar. So coming to the sleep duration from the neonates, pediatric, adolescents, adult, and the geriatric populations. How much sleep is essential for healthy individuals?
Thank you, sir. Sleep duration, as you have already told, in different individuals is different. Also, the age-wise, it changes. Sleep duration among the individual also varies. So there is not specific that this individual is having a good amount of sleep according to the duration. As I've already mentioned, the quality is important, but also a certain amount of time is also required for the restorative function of the body. So here also the National Sleep Foundation has given a certain limit, and these limit are the minimum or maximum limit, and these limit are based on the population study. But as an individual, the changes. Some are called short sleepers, some are long sleepers. The short sleepers are not unhealthy, and long sleepers are also not not disease. There is some genetic predisposition in theories. There is a mutation in DC2 gene happens in some individuals where this mutation causes the short sleepers, and in the long sleepers they need more than 9 hours, and they are called long sleepers. The different factors also influence the sleep duration, like health condition. If you are having a chronic disease conditions, they tend to sleep less. There are some lifestyle changes, the social media use or the mobile use, they sleep less. And also important factor here is the change happens or duration changes with the aging. So older adults have a lighter sleep. So the duration, which is essentially we tell maybe normal is as the newborn are less than 3 months, they sleep for 16 to 18 hours a day, and the as the age goes by, the duration decreases. So and also the changes of the different pattern of sleep. And the infants of less than 1 year, we consider 12 to 15 hour is normal, and the toddlers, they have they need around 11 to 14 hours for sleep. And the school age children, they need 9 to 11 hours, and the teenagers to adults, they varies from 7 to 10 hours. So in adults, 7 to 9 hours is considered to be adequate. And the older adults, as you grow older, more than 65 years, they sleep less than 7 hours also. The trend of decreasing sleep duration over the age is because of the developmental changes in the brain, and also the body activity and the metabolic needs also. So, however, long sleep duration might be appropriate for some individuals due to the lifestyle or health condition. And so, I would suggest that prioritizing the sleep quality then the duration is important also. Thank you. This is my take.
Thank you very much. So, age-appropriate sleep duration is very important. So, we are all adult pulmonologists. Our 25 to 30% practice is mainly the sleep and sleep disorders. So, an average adult, as per the sleep hygiene, so we have to do 6 to 8 hours. 7 is the golden number. So, we have to maintain sleep duration also very important. So, quantity also important. Sleep quality matters, and quality also matters. If you have the sleep deprivation or less duration of sleep, it may cause a lot of health consequences and hormonal imbalances, leads to obesity and obesity. There is a vicious cycle. Okay, we'll come to later about that. Thank you, Dibakar, for this wonderful discussion on the duration. So this thing. Next, I'll move on to Dr. Aditya Aggarwal regarding this. Already, Dibakar and you briefly about touch upon the hypnogram. Those who are late joining here. So, what is hypnogram? So, can you explain about the hypnogram?
Yes, sir. So basically, sir, a hypnogram, it is basically a graphical representation of person's sleep stages that we do it throughout the night. Commonly, hypnogram are commonly used, as we know, in sleep studies to analyze various sleep patterns and sleep disorders. So it basically display the progression of different sleep stages in the night, like from the NREM stage 1 through to the REM, whatever the changes happening in a person's sleep stage. And it do help in assessing the severity of very severe apnea, and even in determining the appropriate treatment. For example, if we talk about the fragmented sleep, so which is very common in sleep events. So basically, if we do the sleep study, we see patient frequently awakes, and then there is patient doesn't go into a deep sleep, which can be a characteristic of sleep apnea. Or then there could be some frequent awakenings between the transition of various sleep stages, which we can see through a hypnogram. Or even if we can see some obstructive sleep apnea events in a person where while during transition to a deep sleep, patient might have a drop in saturation. So all these events can be recorded through a hypnogram, and it is a commonly used tool, as we know, in our sleep study to analyze various sleep patterns and sleep disorders.
Thank you, Aditya, for this wonderful update on hypnogram. Hypnogram in general is pictorial representation of the sleep stages from sleep onset to sleep offset. So, like you correctly said, it's helpful in a staging and interpretation at the baseline and prior to and following treatment. This hypnogram is essential part of our sleep study, and this is available in all the gadgets and all. So we can see whether it's normal sleep or bad sleep, good sleep, everything we can see by seeing the hypnogram. So thank you. So we'll move on to Dr. Ajay, sir. So tell us important endocrine hormonal changes happen during sleep. Ajay, sir.
Thank you, Dr. Jayaraman, for this really important question, because there are 6 to 7 important hormones which regulate our body functions, most of the metabolic functions, and they do get a lot of changes during the normal sleep also. Let's take first the most commonly discussed sleep hormone is called melatonin. It actually regulates your sleep timing and everything. So melatonin secretion increases in the evening, somewhere close to sunset. So our bodies are very much tuned with the sunrise and sunset for ages, like probably since the evolution time. So it starts secretion at the evening, during the sunset, around the sunset, peaks at the night and decreases in the morning. What is its function? It signals body that it is time to sleep. It helps regulate the sleep-wake cycle, that is circadian rhythm. The second important hormone, I'm going to be brief about those 6-7 hormones. Second important hormone is cortisol. We all know that cortisol is basically for our stress response and metabolism. What is the timing? Cortisol levels are lowest at the beginning of the sleep and gradually rise towards the morning, peaking shortly after you wake up. So it basically prepares our body for a wakefulness and daytime activity. Third important and very important, I would say, is a growth hormone. Its role in a restoration of a tissue and muscle repair. What are the timing? Growth hormone primarily released during the sleep stage 3, slow wave sleep. That's where the repair function of your body happens. Promotes cell regeneration, muscle repair, and fat metabolism. So when you don't get an N3 properly, you tend to gain a lot of weight in your body, especially in the central part of the area. So that's why in a certain literature, they say N3 sleep is a beauty sleep also. It actually makes you stronger, beautiful, and maybe in a shape. The fourth hormone is leptin and ghrelin. I'm keeping these two hormones together because they work in a synchrony with each other. So what both these two hormones do, they regulate your appetite. So leptin increases during the sleep to signal the satiety and suppress your hunger, whereas ghrelin decreases during sleep to reduce the appetite. But when your sleep disturbs, then what happens? Poor sleep can disrupt this balance, leading to increased appetite in a late night hours and potential weight gain. So these two hormones in a coordination with each other actually regulates your appetite and your weight management. Fifth important is insulin. We all know that insulin sensitivity fluctuates during the sleep, where body being more insulin sensitive during the early part of the night. It helps regulate blood sugar levels during the sleep and energy storage. So if your insulin secretion is good, if your insulin sensitivity is good because of a good N3 sleep, then you probably don't get a hypoglycemia and hyperglycemia episodes during the sleep. The sixth important hormone is testosterone. It is basically responsible for reproductive and anabolic processes. Testosterone level peaks during REM sleep. We all know that in a REM sleep, your testosterone goes at a peakest level, and they're highest in the morning after sufficient sleep. So when your sleep gets disturbed because of any fragmentation, it basically affects your libido, it affects your muscle mass, sarcopenia gets developed. The last hormone, which I want to discuss in this particular platform, is thyroid stimulating hormone. That's a TSH. It basically regulates your thyroid function. It peaks in early sleep and decline towards the morning. It obviously supports the energy balance and metabolism. So all these 7 hormones are basically, as we all know, they regulate most of the lifestyle disorders and muscle repair and tissue repair for our body. So they do have a fluctuation during the sleep, even in a normal sleep. So to maintain these hormones properly, you have to basically ensure the regular schedules of sleep, consistency in a routine, so that these hormonal balances remain properly and you have a proper life. Thank you.
Good, fantastic. So the hormone and sleep is a very important thing. There are 7 hormones during sleep. It regulates all the metabolism. Mainly the sleep hormone melatonin. It secretes mostly in the dark nighttime. So growth hormone is very, very important. So all growth overall. And leptin, ghrelin. This is a very important thing. So this is a hunger. One is the hunger suppressant hormone. Leptin, ghrelin is a hunger stimulating, appetite stimulating hormone. So any imbalance between these two causes a lot of eating habits and obesity. A lot of vicious cycle. And the insulin is a very important thing. We're all India is diabetic capital in the world. So insulin resistance is one of the important things. Secretions, testosterone, one of the sex hormone, and thyroid hormone. So a lot of hormone influences the systemic and metabolic disease. We are seeing a lot of things. So sleep is an paramount important. So in this sleep hygiene, consistency, sleep schedule, all important. So thank you, Godse sir, for the nice answer about this kind of hormones and sleep. So we'll take some questions from the chat box. Dr. Jyoti Dang from Rajasthan, Kota. Please share your experience of sleep study in pregnant women suffering from snoring. Do you recommend sleep study in pregnancy? Anyone you can take. Kewal sir?
She's my wife, actually. She's a gynecologist.
Oh, yeah. Fine.
but I don't have any experience sleep study or in the pregnant woman.
Ajay sir?
Anybody can take it.
Yeah, it's absolutely okay to have a sleep study in a pregnant woman. It's exactly the same study which we'll do in other people also. You'll probably require level 1 study because of other factors are also getting involved. So probably level 2 or level 3 study is not I would recommend in a pregnant female who are you are suspecting sleep disorder breathing. So levels 1 study, in lab study in a hospital when there's an attendant available, you have better safety measures, and probably a lot of complications could happen during that particular thing. So it's better to have an in-house attended study, and rest of the things are exactly the same. Your procedure of a study is same, interpretation is same, treatment is also same.
Most of the pregnant lady have a disruption, disruptions. So at what stage and which trimester we should do the sleep study in pregnant woman?
Okay, so basically sleep disruptions, a thorough history would give you clue, frankly. If these are sleep disruptions which are not associated with daytime consequences, if their sleep disturbances are not really causing metabolic disturbances, then probably those are pregnancy-related physiological sleep disturbances. But if they are causing daytime consequences, metabolic dysregulation, somebody's diabetes is getting haywire, somebody is getting a preeclampsia or eclampsia, snoring is increased, they're getting suffocation throughout the night, then obviously you don't require to wait for any stage. But then what experience tells us all throughout the world, that second trimester onwards, the increase in an interruption of the sleep disorder breathing is increases in a pregnancy, second trimester onwards.
Thank you.
And it's a very important to treat it. It's a very important to diagnose and treat it, because most of the cases, I have my personal experience with stillbirths or recurrent abortions, because the lady was not really diagnosed and treated for her sleep apnea. Okay, I'll share this particular thing if I have 1 minute. This particular lady came to me referred by a gynecologist, and I was genuinely clueless when I recently came from a US and started practicing here. I said, why you are here in my clinic? You are pregnant. She said, my gynecologist told me that this is third stillbirth or spontaneous abortion. They want me to see sleep specialist. Okay. Then I went through the thorough history. She was an IVF case. She was given a lot of hormonal injection to carry the pregnancy. Now with every IVF injection and that sessions, she started gaining weight. So she started snoring more. She started getting sleep disturbances more. And gynecologist of opinion that probably she has developed obstructive sleep apnea. And because of that, there's a fetal hypoxemia. And that's why there's a spontaneous abortion happening. We took that particular call. That was my first pregnancy and OSA association. We took that particular call, got a sleep study done. She was severe. She had a severe OSA. We treated that particular lady. That particular pregnancy also, she got aborted, unfortunately, within a few weeks of her treatment. But next pregnancy, when she conceived, she had a full-term baby, and everybody was so happy. And then since the time, I had come to Hyderabad also to talk. Hyderabad has one very famous Elizabeth Hospital, which is basically catering to only women health. I had a discussion over there. There are a lot of cases where pregnancy have a sleep disorder breathing, and which needs to be addressed, diagnosed, and even treated, because they can actually carry a lot of consequences if you don't really know them and address them.
Thank you.
One thing you have to important is that whether the person is snoring before the pregnancy or not, that also be taken into account. And the second trimester onward, the abdominal movement decreases, so there will be issues with the also with the sleep scoring and all those things.
Yeah, thank you. Again, the same question like I am posting to Dr. Kewal sir. How does pregnancy affect sleep? There are a lot of hormonal changes during pregnancy and during the sleep. There are how to assess in the case of pregnant lady. How does pregnancy affect the sleep? Just you can give some tips. Already Ajay Godse told about in brief about the pregnancy and the sleep and pregnancy vicious cycle. So it will take care of any stage of pregnancy, whether first trimester, second trimester, third trimester. If we think in terms of significant disease, the comorbid conditions, hypertension may lead to preeclampsia and all. So we'll do that interventions. So what is your take on this pregnancy affect sleep?
This topic has already been discussed by Dr. Aditya, but this population is not explored by us or by the obstetrician. And the effect of pregnancy on the sleep, most of the pregnant ladies, almost 67 to 98%, have a sleep disruption. And these occurs because of the hormonal, anatomical, and physiological changes. In the first trimester, because of the increased urine frequencies, nausea, mood changes, and lack of psychosocial support causes the sleep disturbances. And these pregnant ladies will have frequent daytime nap, less sleep efficiency, less slow wave sleep, longer time to sleep onset, wake after sleep onset will increase. In the second trimester, slightly sleep parameter will improve and patient will have slow wave sleep, and REM sleep doesn't change in this phase, and decreased time to sleep onset will occur, and wake after sleep onset also reduce. Overall sleep efficiency improves in this phase. But in the third trimester, most of the pregnant women, almost 98% women report sleep disturbances because of the nocturia, abdominal discomfort, breathing disturbances, uterine contraction, increased heartburn, breast tenderness, restless leg syndrome, and fetal movement. Overall, decreases the sleep efficiency, nightmare, which causes low slow wave sleep, low REM sleep, and increases the VASO. Apart from that, various hormonal changes occurs, and it also affects on the sleep, especially progesterone level, which are high during the pregnancy, and it acts as a analeptic and improves the breathing and improves the NREM sleep. On the other hand, estrogen level releases by the placenta, especially in the third trimester before the birth, it stimulates the prolactin hormone, which suppresses the dopamine and which may cause the restless leg syndrome and causes the sleep disruption. On the other hand, cortisol level are very high after the 25th week of pregnancy. This may cause short and poor quality of sleep. So these hormonal changes are also causes the sleep disruption. Apart from that, melatonin hormone are also high in the third trimester, which is essential for the fetal placental uterine hemostasis. And it's synergized with the oxytocin, which increases the uterine contraction, and that also causes the sleep disruption. Apart from that, anatomically, in the third trimester, because the pressure impact of the fetus on the diaphragm, which causes ventilatory defect, and simultaneously retention of water in the body causes the decreased diameter of the upper airway, and which leads to obstructive sleep apnea. That's overall sleep disruption occur in the pregnancy.
Yes, sir. So a lot of changes during pregnancy. It may cause a lot of pathological also. So you have to treat appropriately and evaluate appropriately. Thank you, Kewal, sir. There is one question from the chat box. Dr. Divya from Tamil Nadu, Erode. What about setting alarm and quality of sleep? Is it a good habit to set alarm clock regularly?
Can you repeat that, sir?
Yeah. See, what about setting alarm and quality of sleep? Is it a good habit to set alarm clock regularly or not?
May I take this?
Yeah, please.
Setting a alarm, as I have already told in the by a hypnogram. If you are as we go to sleep, there is a NREM. We go to NREM, and when you wake up spontaneously, we wake up from the REM sleep. And if you are setting an alarm, then you might be setting in 4 hours or 8 hours, but it is not that you are waking up from the REM sleep. So the REM events will be REM cycle will be less in setting a alarm. So the quality will definitely will be less. But at the same time, if you are setting for months together or years together, and you can adjust the duration, then it might not might not give you any health hazards, but this will be not very useful when you are sleeping for a short duration, 2 hours, 3 hours. So your sleep duration as well as the quality will be compromised.
Yes, I fully agree. So definitely the initial part, if there is a short-term effect of putting alarm, it will affect your no, REM sleep definitely. In the long run, it's okay. So if you have very short duration of sleep and all, it has some adverse reactions. So overall, if you long run, if you're following regular sleep schedule, this is okay. So initial period, some disturbances. Later part, you can accustom and you wake up before setting alarm. 4 o'clock, 4 a.m. 3:55. Automatically, the sleep cycle, everything is get over. So thank you. We'll move on to the other questions. Again, Dibakar, there is a question to you only. What are all the physiological effects of sleep stages?
As as we are discussing about the physiological effects, I
Yeah,
have
please
already
once
told
again throw something.
sleep is a physiological state. So different sleep itself is a physiological state, and during sleep there are other parameters of the physiological parameters of body also changes. So I will basically divide into NREM and REM sleep. In NREM sleep, as you know, the brain activity decreases, and especially higher cortical region activity decreases, and the slow wave sleep activity reflects the synchronized neuronal activity, which is crucial for the physical restoration and the memory. Whereas in the REM sleep, there is increased activity mostly in the limbic areas and occipital cortex areas, and the heart rate, which goes down during the NREM sleep, and during REM sleep, the heart rate is normal, or there is some burst. During burst, the heart rate goes up, and next parameter is the blood pressure. The blood pressure obviously decreases during the wakefulness, from the wakefulness in NREM sleep, and in REM sleep it increases up to 30%, and mostly during the phagic wave of the REM sleep. The cerebral blood flow in NREM sleep has not much change, but in REM sleep and REM sleep, the blood flow increases up to 200%, and it depends on which area. It varies from areas to areas. And the body temperature regulation also one of the important factor in non-REM sleep. The body temperature regulation is regulated in a very lower threshold, and so we will have shivering and shivering and sweating during the in non-REM sleep. But in REM sleep, the thermoregulation is suspended, so the mostly the body is poikilothermic. And important part here is what we as a pulmonologist should know about the physiological effects of the sleep in the respiratory physiology. uh, as we all know, respiratory physiology, the respiratory drive is both feedback and feed negative, or positive or negative feed forward feedback mechanism. So respiratory control mainly the central drive, which is controlled by the pons and medulla, and as we have already discussed. And during wakefulness, we have the metabolic pathways are active, but during sleep, what happens? The metabolic demands decreases. So the central drive also decreases, and it is down regulated by the stress receptors, and and the muscle tone and other ventilatory mechanics. There is the muscle tone is decreased, so diaphragm, as the diaphragm is the primary muscle in the respiration, it also goes down. Then the tone of diaphragm goes down, and other accessory muscles also goes down. uh, but in REM sleep, there is marked hypotonia or atonia, except few phases of this phagic wave, and the hypoxic and hypercapnic ventilatory drive. In non-REM sleep, the hypoxic ventilatory drive is reduced by around one third to two third of the wakefulness, and but in and the hypercapnic ventilatory drive in non-REM is decreased by 50%. And in REM sleep, the hypoxic ventilatory drive is more reduced to 1/3 of the wakefulness, and the hypercapnia also decreases to 1/3 of the wakefulness. So there is a blunted response to increase risk of hypoventilation during REM sleep. See, and also we know the upper airway resistance, which is important parameter in OSA, is also increased during the sleep stages due to the relaxation of the pharyngeal muscles. So also, to summarize the respiratory physiology, the minute ventilation is decreased by around 1 to 2 liter during sleep, and also the PaCO2, the arterial carbon dioxide level increases by around 2 to 8 millimeter mercury during sleep, and the PaO2, the oxygen level, also decreases by 3 to 10 millimeter, so that there is a slight drop in the saturation of around 2% during the sleep. So the ventilation perfusion mismatch also happens due to the supine position, as well as the functional residual capacity also reduced.
Yeah.
These are all important to know.
Fine. Yeah, thank you, Dibakar, for the wonderful detailed discussion on the various physiological effects on various sleep stages. Thank you. We'll move on to the, in the continuation of the same thing, we'll come to the mechanism of sleep. So mechanism of sleep means mainly it has a two system located in the brain. One is the homeostatic process, other one is the circadian rhythm. So I'll ask the Aditya, can you throw some light on sleep homeostasis or the sleep orchestra, sleep mechanism briefly? Homeostasis.
Yes, definitely, sir. So basically, sir, sleep homeostasis is very important as it regulates our sleep and wakefulness. It is a process which maintain a constant sleep-wake cycle, and it ensures that body get our enough sleep for restoration of a normal function. For instance, if we see how this mechanism works, basically there is a sleep drive pressure which is there in the body. The longer we stay awake, so the longer there is a urge to sleep. So the longer this sleep drive pressure builds in the body during the daytime, and as the evening process, this sleep drive pressure is mainly responsible for the sleep, and the body releases adenosine basically. So there is an accumulation of adenosine in the body, and which promotes sleep and build up sleep, which is very much responsible for the sleep homeostasis. Then there is a circadian rhythm, which is very important. So circadian rhythm is basically responsible, as Dr. Dibakar sir has already explained, for the timing of the sleep. So basically during the light, it is during the darkness, the circadian rhythm do rises, and then they together homeostasis and the circadian rhythm mix match together and then promote sleep.
Thank you. Thank you for the sleep homeostasis, sleep mechanisms, and sleep wake cycles, the link between that. So coming to Ajay sir, so tell us how circadian rhythm affects the various stages of life.
Ajay. Very interesting question. In fact, we go through a lot of stages. First is infancy, then is the childhood, then there's the adulthood, then there's a geriatric age group. So every time the natural need of sleep changes, and that's what is all about normal physiological circadian rhythm. So in infancy, newborns have this circadian rhythm which is not well developed. It's an immature circadian rhythm. So they rely on external cues like a feeding or light exposure. By the age of 6 months, 3 to 6 months, circadian rhythm gets synchronized and they start getting a day-night cycle. Sleep is very much fragmented in infancy. Very short duration of sleep, 2 to 4 hours of cycle, but repeated cycles. When this rhythm matures, they develop longer nighttime sleep and shorter daytime nap. But that takes about 6 months for that particular thing to organize. If that particular circadian rhythm is disrupted in that age group, then it hampers the feeding pattern, it hampers their growth, and it hampers even parental well-being also, because parents also cannot cope up with disturbed circadian rhythm of the kids. The second thing is early childhood, school age people. They genuinely need 9 to 11 hours of sleep for a well-aligned circadian rhythm. But we all know that all throughout the world, school timings, early school timings are basically giving them inconsistent sleep schedules, delay in sleep onset, and affecting their cognitive and social development because of these particular things. Let's talk about two important phase syndromes. One is adolescent, that's a delayed phase shift syndrome, and another is geriatric, that's a advanced phase shift syndrome. Now, these are technical words. I know one of few talks in next series of a sleep, you are going to cover all these circadian things. I genuinely believe that. But in adolescent, naturally, teenagers experience natural delay in melatonin release. So I just wanted to mention it here with August audience of 1,300 and something, that when your kids start sleeping late, 2 o'clock, 3 o'clock or 1 o'clock in the night, that's not they're doing purposely. It's naturally their melatonin is secreting little late. So that leads to later sleep and later wake times. But the only thing is, in our education system, they are not allowed to sleep late till 9 o'clock or 10 o'clock when they are going to finish their 8 hours of sleep. So if they sleep by 2, they're going to finish their 8 hours by 10. They need to wake up by 6 or 7 to reach the school. And that affects their academic performance, emotional stability, and even physical health. They fall ill very often. That's a delayed sleep phase sleep syndrome. The opposite is something in a geriatric population where their phase syndrome is advanced. So you must be noticing that your elderly parents, they try to wind up their day by 6:30 or 7 o'clock. Their body needs sleep from that particular time, but probably conducive environment in a cities is not acceptable to go to sleep. So they tend to make themselves pull through the early part of the night, but then sleep exactly by 2 o'clock or 3 o'clock, their sleep gets finished. Their need of sleep gets finished, and then remain awake from that 3 o'clock to 6 o'clock till the whole family wakes up. And we genuinely wrongly report them as insomnia. It is genuinely not an insomnia. If you take a history properly, if they go to sleep by 7 p.m., then probably by 3 a.m. they'll finish their 8 hours and they'll have a good sleep. So we have some medication and techniques to advance to correct this particular phase disorder. So circadian rhythm definitely plays a lot of role into every stage of our normal behavior or growth.
Fantastic. Circadian rhythm is a biological clock to maintain the sleep from the various, from neonates to the geriatric populations. Thank you, sir. So, over to Dr. Kewal, sir. Can you tell about the pattern of sleep in teenagers? Briefly about it. Yes. Kewal, sir?
This age group needs, this age group needs better demand of sleep because of the social, cognitive, and behavioral function. Physiologically, normally they need 8 to 10 hours sleep, and they have lesser slower sleep, and 2 is more in this age group because they need memory consolidation more, and especially muscle spindles are responsible for the memory consolidation. And so in this age group, N2 is more, and time to REM sleep is reduced in the teenagers, and it scars their brain, and they can tolerate sleep pressure. As Dr. Ajay has already told, that they have delayed phase of sleep. They sleep very late because they have their melatonin peaks in the late night. And because of the early school schedule and extracurricular activity, increase screen time and increase peer pressure group, most of the teenagers are sleep deprived globally. And most of them have varying sleep time on the weekday and weekend. So they develop sleep pressure on the weekend. And finally, they feel jet lag on Monday. So because of the modern style, most of the teenagers suffer sleep deprivation. This is the pattern of sleep in the teenager group.
Thank you, Kewal, sir, for this wonderful update on this thing. And coming to Dr. Dibakar, so what changes in sleep architecture do we see in an infant to adults?
As we have already, thank you, sir. As we have already mentioned about the sleep duration during different individual, different age group. Also, the sleep architecture also changes. A newborn who sleeps for around 18 hours a day, most of the sleep is the REM sleep. As a parents, we can know that their sleep pattern very erratic. They can wake up at mid of the night also because of the circadian rhythm. The newborns mostly have three different type of sleep, like not very non-REM or REM, but there is a quiet sleep, then a indeterminate point of sleep, and the active sleep. So quiet sleep is mostly NREM type, and then active is like REM sleep. And the circadian rhythm usually starts to develop at around after 1 month or more, up to 3 months, leading to longer period of wakefulness during the day. So in the newborns, the sleep cycle is 50 minutes in comparison to adults, which is around 90 minutes. And the as the infant grow older, the sleep duration also decreases, and there is longer nighttime sleep than the daytime sleep happens, and short naps in the day also happens. In the toddler of 1 to 3 years, there is the circadian rhythm is fully established, aligning with the day-night sleep they happens. And the preschool or early school as years, they have longer REM latency than the younger child. And also in that preschool years, there is more N3 sleep starts to develop, that they slow wave sleep starts to develop. So that's why that's in that age group the memory and the growth and the development happens. The in the adult end, less than 18 years, from 10 years to 18 years, there is a gradual decline in slow wave sleep and increase in time in the N2 sleep. Matlab, there is shift in N3 to N2 in those areas, and the proportion of REM to non-REM also stabilize in those in those years. In the adults, the sleep duration, as we have already discussed, is 7 to 9 hours, and 4 to 5 sleep cycles, and the proportion of REM and non-REM stabilize, and the N3 continues to decline. But when you grow older, more than 65 or 70 years, the duration decreases, and there is less restorative sleep. N3 still less. So increased wakefulness during the night also happens in those areas. So the key observation which people should know about, that declining biological necessity decreases the sleep quality as well as the duration, and the circadian rhythm maturation helps us to which fully develops at 6 years, allows for the structured day-night sleep pattern.
Thank you very much for this wonderful insight on sleep architecture. So from infant to adults and various stages of report. Thank you, Dibakar. Coming to Dr. Aditya, can you throw some light on snoring during sleep, dreaming? It's a very, very important thing, dreaming during sleep and talking during sleep. Whether is it a physiological or any cutoff point to evaluate further? Yeah, this is the parasomnia way to do the thing. This is a OSA way to rule out that. So any cutoff point about the dreaming, sleep talking, and snoring, Aditya?
Yes, sir, definitely. Sir, as such, there is no such physiological cutoff, but there are certain patterns which might warrant us that we may investigate further. For example, if we talk about the snoring can be normal in supine position, in certain positions, or even if person takes alcohol, patient do snore. But if snoring is loud, or if snoring is frequent, with the disruptions are there, and whether if the snoring is associated with a pause in breathing, if a person experience choking or gasping, then it might indicate that there might be some event which might be going on, and it should warrant further investigations. And if snoring is also associated with patient affecting the sleep quality and causing daytime sleepiness, then one should thought for evaluation, and then one should seek for a pulmonologist or a sleep specialist to further evaluate. Now, coming on to the dreaming, as we know, we have studied, and as Dr. Dibakar sir has, as Dr. Kewal sir has already explained clearly, that dreaming usually occurs in REM sleep, which we commonly see. And there are, if dreaming is normal, but if dreaming is associated with nightmares which are so frequent, and if it is associated with very vivid dreams or disturbing dreams, and if dreaming is associated with sleep disruptions, or if there are some REM disorders which are there in the during the dreaming, then it might suggest that there might be some underlying illness which might be there, and then we should warrant for further investigation. Coming on to the sleep talking, which is better known as even somniloquy, and it can be normal during the transition phase, with the transition of the stages, like in the lighter stages of sleep, like in stage 1 or stage 2 NREM. Sleep talking can be normal. But if sleep talking becomes frequent, or if there are loud sleep talking, if a person is experiencing a loud sleep talking regularly, it is occurring, it is disrupting the sleep, the patient is not able to go into the deep sleep, then there might be a need for evaluation. Or even if sleep talking is associated with various parasomnias, like patient is sleepwalking with it, then there are associated night terror. If there are some RAM disorder behavior associated with it, then there might be an indication of underlying going stress or sleep deprivation, or even some neurocognitive disorder behavior is also possible.
Yes, fantastic update on this snoring, dreaming, and somniloquy. So we went to evaluate and all. So very nice. Any other panelist wants to update regarding any dreaming in sleep? Ajay? Ajay, sir?
Actually, sir, I want to take one question of NH Krishna, sir, which we recently chatted, and he took with us that when someone is chasing in our dreams, how much faster even we try to walk, and our legs are not moving slightly or don't move at all. I think it can be related to REM paralysis if we think about it, because in the REM sleep, our body brain signals that it wants to paralyze our muscles. That could be a protective mechanism which could be there to prevent us from injury. Because if someone is chasing to our dreams and we are also running behind it, then there could be a issue of injury as well. So brain is disconnecting us. There is a disconnection, and it might lead to such sensation. Then there could be some motor activity which we can relate with it, like in REM sleep. If we see there is an inhibition of motor activity, as explained earlier by our eminent panelists, so it can also lead to such sensations, and it prevents our limb to move physically, basically.
Thank you. Thanks for wonderful insight on this question on this dreaming. Correct. So we'll move on to Dr. Ajay, sir. Tell us about effects of sleep deprivation on our bodies. This is a very important thing, sleep deprivation.
Thank you, Dr. Jayaraman. Probably this is the most important question in the world at this particular moment. Everybody is sleep deprived, probably even me, being a sleep physician also. Okay, let's divide these particular effects into two parts, short-term effects and long-term effects, because most of people do have a short-term effects of a sleep deprivation. We are not chronically sleep deprived. Certain times when there's a ICU calls, when you travel from one place to another place, moving the continent, then you definitely get a sleep deprivation. But even a slightest sleep deprivation, even for a short term also, definitely have some body effects. So let's talk about short-term effects first. First is there's a cognitive impairment. So there's a reduced attention span. There's a concentration which is reduced. Decision-making ability reduced. Poor memory retention and recall. Decreased risk of accidents due to slower reaction time. Now there's a notion in our country that we tend to study for longer hours in a night, and then we hope that we will recall that in the next day morning studies or examination. Probably this is a misnomer, because if you don't sleep properly, the memory doesn't get retained properly. So probably all the kids in a educational arena should be told that when you sleep properly, you will probably remember it next day morning better than having a less sleep. So that particular thing is a memory consolidation. There are mood disturbances which happen because of a sleep deprivation. So irritability, anxiety, heightened emotional reactivity, violent behaviors. Increased stress level due to hormonal imbalances, especially elevated cortisol, which also happens in a short-term duration. Physical performance, you have a decreased energy levels, you feel fatigued. If that particular thing happens very frequently as a long-term thing, then you have a weakened immune system. You have an increased susceptibility to infection, especially viral infection, because of a lessened immune system. Hormonal changes do happen in a long-term sleep deprivation. Increased ghrelin, decreased leptin leads to increased hunger, especially daytime as well as in the nighttime. Cravings for a carbohydrate-rich or high-calorie-rich foods, and that definitely increases your abdominal girth, obesity, and then chronic effects. Now let's talk about some metabolic functions which affect because of a long-term sleep deprivation. We all know that cardiovascular diseases, increased risk of hypertension, heart diseases, stroke are increased because of a long-term sleep deprivation due to elevated blood pressure and inflammation inside the vessels. Metabolic disorders because of high risk of obesity, because of disrupt metabolism and appetite regulation. We just discussed about insulin also. It increases the chances of type 2 diabetes, whether it appears or it further deteriorates. Hormonal imbalances causes disruption in growth hormones, so your repair mechanism also gets affected. Mental health problem, chronic anxiety, depression, mood disorders, that can be a result of a chronic sleep deprivation. Basically, these are basically bodily effects. There's a brain also which gets affected. So there are neurodegenerative diseases like Alzheimer's, which happens because of a chronic sleep depression, because of an accumulation of toxins, which doesn't get cleared during a sleep. So people do develop diseases, neurodegenerative diseases because of a chronic sleep deprivation. Life expectancy also decreases if you have a chronically sleep deprived. So there are profound effects of a sleep deprivation on our life.
Yeah, so well said about the sleep deprivation. So sleep quantity and body weight, there are acute effect and long-term effect. So sleep deprivation has a lot of adverse reactions. So we have to keep the sleep schedule properly. Otherwise, sleep deprivation due to various work schedule, work-related, stress-related, lack of sleep is lead to a lot of abnormality in the hormone imbalances, leptin, ghrelin abnormalities, which leads to a lot of disease problems in the form of metabolic diseases, etc. Thank you very much for this wonderful insight, Dr. Ajay sir. So now almost we'll be at the end of the session. Thank you all for this wonderful question. I learned a lot of things from this discussion on sleep physiology. I thank you all. Finally, I request each panelist to give one take-home messages about the sleep physiology. I start from Kewal sir. Take messages.
Not only the duration of sleep is important, it's the quality of sleep is also important for the well-being. This is my take on this. So better you concentrate on sleep quality also apart from the sleep duration.
Well said. Yeah, sleep quality. Thank you. Aditya?
So basically, from my perspective, I would like to say that basically sleep is very important for overall health and well-being of a person. So a person should sleep properly for optimal functioning, because as we have already seen that sleep is related to various physiological functions like memory consolidation or physical restoration. So a proper sleep, a proper genuine quality sleep is must for each and every individual for optimal functioning and well-being.
Thank you. Dibakar sir, you take a message.
Sir, thank you, sir. My message is understanding of sleep physiology is important. As we, as a pulmonologist, should are treating always the sleep disorder, breathing, and all those things. So everybody should understand the sleep physiology as well as the respiratory physiology, which changes during sleep. That is the change in minute ventilation, change in the oxygen saturation, hypercapnic drive, the hypoxic drive. So that is also important. And also, as all the panelists has emphasized the sleep quality. So that is also important in every individual. And away from the social media and during night, you're using a mobile also affects your body.
Thank you, Dibakar. Finally, Dr. Ajay Godse sir, you take a message on the sleep physiology.
I must congratulate course coordinator for this topic, because while I was preparing for my fellowship or WSS exam, this particular physiology and anatomy of a sleep is a most neglected part. What we discuss in all the webinars and conferences is sleep pathology. But to understand pathology, you need to know physiology better. So I guess you have prioritized this particular topic in a sleep series. I want to extend that sentence further. Prioritize your sleep in day-to-day routine. Your exercise routine and your sleep routine is essential for you to age gracefully. And I'm using the word age gracefully, because if you want to age gracefully, all your tissues, functions, organs, functions should adequately remain for longer duration. Prioritize your sleep, prioritize your exercise routine, physical activity. That's all. Thank you very much for this opportunity.
Thank you very much, Ajay sir, and thank you all the panelists for this wonderful update about the sleep physiology. So sleep is an extremely complicated process. So the stages of sleep, starting from the wake and the non-REM sleep 1, 2, 3, and the REM stage, again the sleep-wake cycles. There are a lot of mechanisms involved in that. It has two systems in the brain. One is the homeostatic process with the sleep centers, and the circadian rhythm. There is a biological clock which regulates the sleep-wake cycles. And the quality matters than quantity. Sleep deprivation is a very important thing. A lot of hormonal imbalances, and the sleep on the physiological aspect of the pregnancy, elderly, and the geriatric population, pediatric. So each and every stage of sleep and sleep patterns all important. So why do you sleep? A lot of theory behind. Still, the exact purpose of sleep has not been fully elucidated. There were a lot of discussions on the various stages of sleep, so physiological functions, hormonal actions, and the balancing activities. There are so many things. So we learned so many things about the sleep discussion, the physiological discussion. I thank you, the course director, Dr. Shivani Swami, and Dr. Ravi Dosi for the wonderful topic as chosen. As I am lucky enough to moderate this stalwarts here, Ajay, Godse, Dibakar, Aditya, and Kewal sir. I thank once again the CCI, our founder, trustee, chairman, Dr. Krishan sir, Narayan Pratibha sir, and our CCI President, Dr. Ashish Dubey, Secretary Anil Maske, CCI Webinar Coordinator, Dr. Jaipur Chennai Chetty, and all the leaders behind the CCI. They work hard 24/7. So this is the 5th year successfully. Every Thursday we are enjoying this the webinar topics. There is no repetition at all. Each and every time is a different kind of topic and different kind of speakers and all. I thank all the CC leaders, Dr. Kirat and Dr. Atri Gangopathy, all the leaders. So I thank you very much for this wonderful opportunity to moderate this panel discussion webinar on the sleep physiology, sleep webinar series part 1. So next Thursday again, we'll meet with a different topic. So I thank you, one and all. Long live CCI. Thank you. God bless you. Good night.
Thank you. Thank you, sir. Thank you.
Thank you. Good.